Good afternoon, everybody. I'm Dr. Hima Deepti. I'm a consultant nephrologist and renal transplant physician at Arid Hospitals in Gachibowli, Hyderabad. Today, I'm here to talk to you about chronic kidney disease. The burden of the disease is very high in India and also globally, where there are plenty of patients with suffering with chronic kidney disease. The burden of diagnosing and treating falls on physicians and more so on nephrologists. So, how do we diagnose the disease? We diagnose it based on GFR, that is glomerular filtration rate, and that is calculated based on creatinine. So, what is chronic kidney disease? If there is change in function or structure of the kidney which lasts more than 3 months at least, that is documented, we label it as chronic kidney disease. There could be change in function, that is a decrease in glomerular filtration rate or rise in creatinine, or there can be evidence of proteinuria, or there could be signs of shrinking of the kidney or any such events. We label it as chronic kidney disease if it is more than 3 months duration. So, what are the common signs and symptoms of chronic kidney disease? Chronic kidney disease usually starts very insidiously. A lot of people don't present with symptoms. But if you notice swelling of your ankles or puffiness in your face in the morning, if you have uncontrolled blood pressure, if your blood sugars are fluctuating a lot, if you notice that you're easily tired or fatigued easily, you're unable to sleep well, if you're feeling breathlessness, that is even short activity, you're feeling tired or breathless, or if you're feeling unable to eat, or you're feeling nausea or something like this, all could suggest these are non-specific signs and symptoms, but it could mean that your kidney function has deteriorated. So you have to watch out for any of these symptoms that are worsening, or if they are persistently present for a long time, get your tests done and get evaluated for chronic kidney disease. But does everybody have to be worried about chronic kidney disease? Not usually. People at high risk of chronic disease are usually diabetics with long standing uncontrolled sugars, hypertension which is not explained by general causes like systemic hypertension. So these patients are at the highest risk. So you have to screen for your kidney function on a regular basis. People who have a history of kidney disease in their family, like let's say if your mother or your father has diabetes and they landed up on kidney failure, or if there are some genetic components like cystic kidney disease, these patients also have to be are at high risk of progressing to end stage renal disease or suffering with early stages of kidney disease. You have to be monitoring yourself. People who have had any history of acute kidney injury also in the past, these people also have a risk of developing chronic kidney disease insidiously at some point in their lifespan. So it can be genetic, it can be because of diabetes, hypertension, cystic diseases, inherited conditions, or sometimes people are born with shrunken kidneys or dysplastic kidneys, as we call it. So these people are at high risk of progressing to chronic kidney disease stage wise. So they have to monitor their kidney function. Also, there are people who use long term painkillers, such as what we call NSAID drugs. So they have to be careful to restrict their dosages and not take for a long duration because they are known to affect the kidney function in the long run. Painkillers, people who use painkillers for a long duration, such as for arthritis or any joint aches or general headaches, should be very careful. So, also people who are using herbal medicine, because indigenous drugs have a lot of heavy metals like mercury, etc., arsenic, mercury. They are known to cause kidney disease by kidney disease in the acute setting as well as chronic kidney disease if you continue to use it for a long time. So these are the at-risk people. Obviously, with age also kidney function deteriorates gradually. So you have to keep monitoring your kidney function. If you have any of these above said problems such as long-standing diabetes, family history, or if there is certain population like certain areas in the city, in the states, in the south state like in Telangana and Andhra Pradesh, where there is extra hard water or groundwater contamination. So these people living in these areas are also at high risk of chronic kidney disease. So you have to monitor these target population have to monitor their kidney function on a regular basis. So how do you monitor? What are the screening tests that are easily available and are not expensive? So the first test you would have to do is, if you're a diabetic, just check urine protein. Everybody in regular touch with the healthcare providers, it is easy for you to come and get your tests done. But at risk population, like I just told, they have to get their urine test done to see if there is any leakage of protein, if there is any blood in urine, or if there is persistent pus cells in urine, or anything like frequency, even frequency of urine, like in the night, or it is disturbing their sleep. Even that is a sign of early sign of chronic kidney disease. So routine screening tests, target population, yes, but anybody with high risk features like I told you, like anything like diabetes, hypertension, family history, painkiller abuse, herbal medication use, frequent childhood urinary tract infections, women who have had BP or sugar during pregnancy are all at risk of developing problems in the future. So they have to be careful and get themselves screened. Easiest screening is urine test. The next level would be blood test to see if there's any change in creatinine, if there's rise in creatinine, serum creatinine, blood urea, electrolytes. If you also have unexplained anemia, that is also sign of early CKD sign. So any of these, because creatinine is the way we measure GFR. So get your creatinine test done as per the guidelines of the physician or the nephrologist so that you don't miss your disease early in its course. So how do you control? Okay, you got diagnosed with chronic kidney disease. It is not the end of life. So you have to diagnose. First, diagnosis is the first step, and then you have to uh, give it a stage of the CKD. Like I said, based on GFR, we classify. So anything between 90 and above is stage 1. If you also have kidney shape or size, echo texture differences, or if you have proteinuria for 3 months or rise in creatinine all for 3 months, stage 1 is above 90, which is usually we allow them to come once in a year or once in 6 months to 1 year. Stage 2 will be something between 60 to 89. This is GFR, that is glomerular filtration rate. These people should also be on regular follow-up. And stage 3 to 5 onwards, they have to come more frequently to get your comorbidities and also your kidney disease checked on a regular basis. So anything between 30 to 60 is the 30 to 60 GFR is considered stage 3. And stage 4 is 15 to 30. Anything less than 15 is end stage kidney disease. And that is what we mostly dread. So how do you control? Like I said, calculate the GFR and you will be assessed based on your GFR and your creatinine and to assess if you have ongoing proteinuria. What is the contributory factor for your CKD? Most likely causes undiagnosed mostly, but a lot of patients usually present with diabetes or hypertension or a family history. So we try to bring these contributing factors under control before we go to the next level of treatments. So what is the first line? Control your blood sugars. Make sure your blood sugars are not having too much of fluctuations. Get your BP medication reassessed, and you will have to use medications that will BP medications that will prevent the progression of kidney disease and also not contributing to worsening of your symptoms. So that will be given to you by the physician or the nephrologist. Coming to other factors, what you see in chronic kidney disease, like anemia. Your anemia should be addressed because it is anemia. It could be because of iron deficiency, folate deficiency, or simply anemia of chronic disease. If it is anemia of chronic disease, you will be given medications like erythropoietin, which will stimulate your bones to produce more blood cells so that your anemia is addressed. If your iron deficiency anemia, if you have iron deficiency anemia, you will be given iron supplements, folate supplements before we are giving you erythropoietin. Similarly, we have to also monitor chronic kidney disease with mineral bone disorders. So anybody with mineral bone disorders, that is low vitamin D, vitamin D is the active component is produced in the kidney. So if there is kidney function deterioration, so even vitamin D deficiency will appear. Then gradually the other hormones which maintain the bone health, that will also get affected. So you have to monitor calcium, phosphorus, vitamin D level, and something called parathyroid hormone. So we measure all these and correct it according to your levels so that your bone is not affected in the long run. And usually these levels start getting fluctuated as early as stage 3. You might not have symptoms, but the levels might change as early as stage 3. So get yourself assessed for anemia, for bone disorders, for BP or sugars, control of your sugars, so that it is all addressed at the same time. Most people ask me about dietary regulations in chronic kidney disease. Yes, it is mostly managed with medication, but diet is just as important. So, what would a nephrologist tell you? You have to have a diet which is low in salt, obviously, because salt retains water, and salt is the major contributing factor for blood pressure. So, salt restriction in your diet, that is less than 2 grams of salt per day, that is one teaspoon of salt per day. That is the maximum you will be allowed as your stage of CKD progresses. Water restriction will be guided by how much your urine output is there. In the early stages of CKD, you will not be restricted to drink less water, but as the chronic kidney disease progresses to later stages, water restriction is advised so that you don't get breathless. And you have to have guided that nutritional therapy, because such as you have to control your potassium intake, that is mostly because potassium is eliminated by the kidney and their levels keep rising in later stages of chronic kidney disease. Potassium has to be monitored. Phosphorus content. Phosphorus is high in milk products and meats. So we will be telling you to cut down on your meat, especially red meat. And also in for potassium, we also advise low in fruit diet. So there are certain fruits that you are allowed to have, and certain vegetables mostly which you are allowed to have on a regular basis. And there are some fruits and vegetables we tell you to restrict based on your potassium levels. So also calcium. Calcium will be supplemented based on your serum calcium levels. So diet, medication, control of comorbidities, and addressing your deficiencies or insufficiencies is the mainstay of chronic kidney disease. So we are only talking about people who are at risk of chronic disease. What about the general population? For the general population, I mostly advise that avoid excessive red meat intake. Go meatless at least one day in a week. At least make it a meatless Monday or a meatless Tuesday. One day without meat. Reduce your processed food intake, such as packaged food and high in salt content, or ultra processed food, as we call it. So avoid those that are packaged. Fresh fruit, fresh vegetable is good on any given day. So control of diet such as red meat and salt and processed food, reduce your sodas and colas and all that, and gradually in the long run that will make it a habit. I've noticed a lot of people continue taking creatine supplements for bodybuilding. That is not good too in the long run. Restrict your protein intake to just as much as your body needs it, that is 1 gram per kg per day, and you will be good. You can do your workouts. Advisable to take whey protein compared to creatine supplements, which are not so good for the kidney in the long run. And also people who have the habit of taking painkillers for every small ailment like a headache or a joint ache or small daily sufferings, it's advisable to not make it a habit, because painkillers lead to heart issues and mostly kidney issues in the long run. So painkillers, if you're in the habit, avoid them. And also people with who don't have kidney issues yet but have had a history of kidney problem in the family, or have had a history of uh, BP or sugar in the family, they are at high risk of developing any of these conditions. So they have to be careful as well. And also keep regularly monitoring anybody with the risk factors I told you about. You have to keep monitoring about your kidney disease. So the target is not to treat first, the target is to diagnose early and treat with the minimum amount of medication as possible so that your disease does not progress from early stages of chronic kidney disease to stage 5 chronic kidney disease, where dialysis and kidney transplant is inevitable. So that is my take home message: to diagnose early and to avoid the comorbidities or the factors that are causing your BP or sugar to go uncontrolled and then causing other problems like heart problems and mainly, from my point of view, chronic kidney disease. Thank you.